Questions?
Governor,
When
Governor-
will states start to submit their reopening plans? Could schools start to reopen as early as this fall, possibly sooner? We're hearing that New York City, their teachers are looking at remote learning possibly in the fall. So I was just wondering about the timeline of all this and what could happen at the earliest.
There will be no opening of any school in the state for the remainder of the academic calendar year. We have to decide on summer school. That decision will be made by the end of May. There is no decision on the fall because the fall is a long time away.
When will schools start to have to be submitting their plans by for the
It
fall?
depends when they're going to open. But they should start preparing their plans now because this is going to be a real exercise, you know. We're talking about how manufacturing companies socially distance, how construction companies socially distance. How does a school socially distance, you know? This bizarre setup here, right? Look at this room. How do you run a school like this? How many more rooms would you need to do this? How many more buses do you need to socially distance on a bus? You know, there's a whole, how about a cafeteria? There's a whole set of questions. How about a dorm room? So they should start working on those plans now.
How do you ensure that
Darren?
free and available
Just to
childcare?
follow up on what Marina's asking, do you think that teachers can realistically do this and school administrators? I mean, kids are kids. They're going to want to run around and be together in a school setting.
Well, look, that is a very good question, Karen, and that's what we, you know, talking to people all across the state, educators all across the state, you can come up with a plan, which is, by the way, very hard, right? They talk about spatial requirements. If you did this, if you required this in a classroom, how many more classrooms would you need in a building, right? But then there's the other question of K to 12, and then how do I get students not to socially distance? You know, how do you tell a 10-year-old don't socially distance? So we're going to err on the side of caution now. That's for the rest of the school year. Summer school, you would need to see, in my opinion, a drop in the, or stabilization of the infection rate for a period of time because kids are going to be kids. I think you're right.
At the same time, the schools are going to lose money. You guys are already talking about cuts. I mean, how are they going to manage all this? If they would, you know, need more classrooms. They don't even have the money for
Well,
that
that's
right
right.
now.
Well, you couldn't get to more classrooms anyway, right? You couldn't build more classrooms in a way that would have any difference for summer school or for the fall. Money is going to be tight depending on what Washington does. And they're doing remote learning. You know, the fiscal consequences are going to be mixed because of this period. Some ways they save money, some ways it costs money.
Governor, do you, sorry to harp on this, but do you anticipate a decision on pause this week again in terms of businesses?
May 15th is the decision on pause.
So will you announce it prior to that, or?
We'll announce it prior to May 15th.
And also, just to follow up, it's been 2 months since the first case was reported. You spoke today of what we have accomplished. And yet there's 18,000 people dead at least, over 300,000 people sick. How would you evaluate your performance during this crisis?
Tried my best.
On the regional reopening, you said that Connecticut, New York, and New Jersey should try to coordinate. The Connecticut governor announced that as of May 20th, some restaurants can open their outdoor areas, museums and zoos can open outdoor areas. Should New Yorkers expect that to happen here as well?
Well, we're aware of what New Jersey's doing, what Connecticut's doing. We're trying to coordinate with those states. I've said from day one, you will not have uniform policies across all the states, but knowing what other states are going to do, because a state can have a significant effect on a neighboring state, knowing what they do is helpful. And then at the appropriate time, we'll make those decisions. The decisions around summer activities are very difficult. You want to look at the tension. You want to get people out of their homes, give them something to do, but you want to keep the infection rate down. You have these mental health issues, you have domestic violence issues, you have a lot going on, so you do want a relief valve, right? It's going to get hot in the summer, hopefully, and you want to have a level of activity. You don't want to overwhelm a neighboring state by keeping everything closed, but you don't want to have high density and violation of social distancing. So that's what we're trying to work through for the summer activities. We have a little more time, and we're talking about that now. Jesse, to go back to your question for a second. I can tell you this. New Yorkers did an extraordinary job and reduced the rate of hospitalizations by about 100,000 and saved thousands of lives. So kudos to New Yorkers.
Isabella Geriatric Center, it was, they had around 100 suspected coronavirus deaths, but the state only had around 13 on hand. They had bodies outside in storage containers. Is there going to be an investigation into the Isabella Geriatric Center, and is there a way that there can be more investigation into some of these coronavirus suspected deaths?
Well, we have the joint effort between the Attorney General and the Department of Health that is going to investigate systemically how nursing homes handle this situation, and specifically individual problem areas that we've seen in nursing homes. So that will certainly be part of the Attorney General and the Department of Health investigation.
Will there be an investigation into that specific nursing home?
Do you know the facts?
Well, we have 613 nursing homes. We investigate anything that comes up. If there's a concern, we will go in there, find out, and report back.
Some of these deaths are going into hospitals. Is there a way to connect those from hospitals? I mean, some of these deaths are saying are in hospitals, but they're actually from nursing homes. Is there going to be more of a, I guess, uniform way of reporting these deaths?
There is a formal, I understand your question. There is a formal process of how we go in to investigate, try to find out what happened, what were the events, what could we do to prevent that in the future, and we're addressing all of them, and whether it's tied to a hospital, tied to the nursing home, or both.
And just so you're clear on the facts now of what we're doing, we report hospital deaths and nursing home deaths separately. That's on the slide every day. The question we're now asking the hospitals, one of the questions that I posed, was someone transferred from a nursing home to a hospital and then passed away in the hospital? And we want to know that. That's your question, and that is a good question, and we're going to be asking that today. And when I get on the phone with the hospitals, I'm going to ask them just that question.
The importance of protecting essential workers. You're disinfecting subway cars and buses in New York City. We're hearing from essential workers in grocery stores who tell us they're overwhelmed by people who are rushing to the store, who are not wearing masks, who are not practicing social distancing. And so I guess the question is, should these stores be refusing to allow customers in who are not wearing masks? And if one of those essential employees is fearful of showing up for work, can they be denied unemployment benefits?
The unemployment benefit denial, I don't know. Maybe it's a legal question. I don't know. Maybe Melissa or Rob would know, or we can check. Look, on the grocery stores, if I'm a private grocery store owner and we have these social distancing requirements in place and masks in place, I think, unless the lawyers want to argue with me, if I'm a private grocery store owner, I would deny admission to a person who is not wearing a mask. You could endanger my other patrons. You could endanger my employees. I would do that. I don't know about the behavior inside a store, but I think the private grocery store owner would be in their rights.
When you mentioned summer school, are you talking about for those students who failed or for everyone?
Summer school, they will do remote learning. They have to continue to do meals, et cetera. We're talking about summer school attendance in the building.
Could you or
Bernadette?
Commissioner Zucker also explain the discrepancy between the nursing home reported deaths? Because as a follow-up to Morgan's question, that specific spot, there's only 13 reported deaths from that nursing home on the COVID tracker. However, we've got a report that they had 46 or 46 deaths specific to COVID, and then potentially more in the 50s. So what's the explanation for that discrepancy, and what are the consequences for
What's the
that?
name of this nursing home, Bernadette?
It's called the Isabella Geriatric Center, and it's in Manhattan.
Does anyone know? Jim?
We went back and asked the nursing homes to provide more detailed data. What they were doing in some cases, and not others, confirmed plus unconfirmed cases. So what we asked them to do is go back and say what were confirmed and what were unconfirmed. So sometimes the number is higher because those are actually unconfirmed cases that they put into certain reporting. We asked them for the confirmed at first, but to get at this sense of what you're talking about, which is why is the number a little higher, we asked them, do you also include unconfirmed numbers in that as well? And what we're finding is they were also including unconfirmed. So what we're doing is putting together a data set right now that has it by confirmed by nursing home and unconfirmed like we were doing with the others too, but that takes a little time to tease out from the nursing homes. This is coming directly from the nursing homes.
Are you concerned with that large gap, 13 versus almost 50 deaths that are being reported? That's a very large number. Are there consequences in case nursing homes are not reporting the accurate numbers, and what are those? Commissioner?
So this isn't, as Jim mentioned, there's two parts to this, but this is an evolving situation of the data that's coming in, and we do track this. If there's a concern about a specific nursing home and what the numbers are, we will look into that as well.
Facing what penalties, though?
They have to attest to the fact that the numbers are true and accurate in every report they submit to us. If the commission, if the Department of Health finds that there was intentional misleading or whatever, they can revoke their license, they can fine them penalties under the public health law, they will send people in. I think under this specific instance, the Department of Health will go in and investigate this to see, like we've done with others as well. Sometimes, as the governor and others have said before, this was an emerging situation. There were mistakes made on reporting. Some people reported deaths from December. That's a mistake. Other cases, if there's potential intentional misleading, the Department of Health will investigate those and then do the appropriate actions.
So let me give you the answer, former Attorney General. They are giving you two sets of numbers, right? Confirmed COVID deaths is one number, then unconfirmed possible COVID deaths, which is this vague category. Maybe the person died of COVID, but we're not sure. So unconfirmed deaths, which is a vague category to define. And hospitals are doing the same thing, by the way. The local governments have to submit unconfirmed potential COVID deaths. So that's a little squishy by definition. And then I can see where there's a vagueness in that category. But they submit these numbers under penalty of perjury. You commit fraud, that is a criminal offense, period. So they can be prosecuted criminally for fraud on any of these reporting numbers. John?
The numbers are so high. Are you concerned, because you have been saying the past 2 months, nursing homes will be like fire through dry grass. Are you concerned that there is this vast gap between the reporting, and also what has the state been doing the past 2 months to alleviate that? Or has this been mainly a county level thing, a facility?
You can't alleviate when they put possible or probable or unconfirmed cause of death. That, by definition, you're asking them a vague question, and they're giving you a vague answer. So they could argue that's not fraud because they did not know. You're asking them for a cause of death. They're saying it's unconfirmed, it's possible, it's probable. But if they misrepresented, then you have a criminal fraud case. John?
You said, Governor, regionally, you said reopening, lifting the pause order will be done on a regional basis as we shift into phase 1. So why isn't the school school closure decision made on a regional basis as well?
Because it's one thing to say you can figure out how to socially distance in construction, or say you can figure out how to socially distance in a manufacturing facility with adults, and you can figure out social distancing, et cetera. To say we're going to figure out that plan and put it in place in the next few weeks is virtually impossible. You know, you can't just think of a school facility, right? And again, go back to this room. You have 30 kids in a classroom, but with social distancing, you can only put 10 kids in a classroom. Okay, then get another 3 classrooms with another 3 teachers. I can't. Cafeteria, at lunchtime, I put 200 kids in a cafeteria. Well, now you can only put 70 kids in the cafeteria. So have them eat in 6 shifts, and figure all this out and get it done in a few weeks. And make sure you don't make a mistake, because we're talking about children and we're talking about them getting infected and bringing either getting sick themselves or bringing it home. So the stakes are high.
You had said in the past, though, you had said in the past that you can't get to a full phase 2 of the reopening unless you have schools open from a childcare standpoint. Does that mean that we won't get to a full phase 2 in any area of the state by the end of the academic year?
Well, during the academic year, you would need to get to a full phase 2, the schools to be operational, right? You can't say, okay, everybody in the state go back to work, but the schools are closed. It'd be very hard for part of the workforce to do that. But you're at the end of the school year anyway here in a few weeks, right? And then you're in the summer months, and then the big question is going to be September. Are you ready to reopen the schools in September? And if you don't, then you can argue you're not going to be ready for a full business opening if you're not opening the schools in September. I think that's true.
Governor, to press on
Governor,
that,
Let me just make sure everyone asks
I
the
have 2
question.
questions. I hope you'll answer both. First off, I mean, there's a huge protest. This time, there's 2 protests going on outside. I know you can hear this time because I can hear in here. So I went and talked to them. I wanted to know what was going on. One is Reopen New York State, who you've already heard from. The other is Citizen Action New York, and they are asking you to cancel rent. I asked the organizer how it would be funded, and she suggested that you tax billionaires. Is this idea feasible, and what is your response to that group of protesters that are lying down Washington?
Yeah, look, you have protesters in front of this building on a continuing basis. You think these are protesters. There's several dozen. You come when we're doing a controversial bill, we have hundreds of protesters all filling the entire building. It's like the building vibrates with the chants. And that's, in some ways, great. That's democracy. People have an opinion. Last week, you asked about the protesters who wanted everything open. The other day, you asked about protesters who wanted everything closed. That's what you get. One day it's everything open, one day it's everything closed. My point is, I get their political opinion. I get the political spectrum. I hear them. I understand why people say, liberate New York, open everything up. I understand why people say, close everything. You're going to kill my children. So I get the arguments. And what I said is, this is not a political decision. Let's make a decision on the facts, et cetera. I get the people who say nobody should have to pay rent. I get that argument. I get the landlords who say, and the building owners who say, if nobody pays rent, I'm going to walk away from my building, and then it's going to be vacant, and I'm not going to pay any bills, because if they don't pay rent, I'm not paying bills, and then you're going to have collapse of buildings. What we're doing is, no one can be evicted for non-payment of rent between now and June. Period. Period. If a person can't pay their rent because of the situation, they cannot be evicted. That is the law till June. That law is in effect till June. And between now and June, we'll see what happens. We'll figure it out. Then we'll figure out what we need to do in June. Last one. Go
Now
ahead.
that hospitals have to report to the state where people are coming from when they're sick with COVID, their addresses, occupation, we're now 2 months into this outbreak. Why didn't we require that sooner when we could have tracked it more, I guess, feasibly?
We have some of the information, but this is now going to be an extraordinary, when I get on the phone with the hospitals, they're going to say this is an extraordinary reporting requirement, right? You had emergency rooms that were overwhelmed. You had administrators who were overwhelmed, working 24 hours a day. To get this level of granular detail on people who are walking in the door and get it to us on a nightly basis, this is going to be a significant administrative burden on them. Are they essential workers? There's no such thing as an essential worker before this. How do they commute? That's a question that I don't think has ever been asked of a patient before, you know. If you are an essential worker, where do you work? You know, these are not questions that the healthcare system ever asks. But since it's down to 1,000 new cases per day, I'm going to say to the hospitals, I understand it's a burden, but it's 1,000 people statewide. It's only several hundred in downstate New York. I understand the burden. The volume is a little lower. This is a little granular. It is more detailed than anything you've ever done. But it's important for us to get it now so we can come up with a more specific, targeted plan. Okay, guys, thank you very much. Thank you. Thank you. I'll see you tomorrow. Summer camp decisions will follow the regional decisions. Whatever we do in that region will apply to the summer camp. Thank you, guys. I'll see you tomorrow.